What kind of medical professional are you?
I'm a registered nurse.
What are the benefits of being in that field?
Well, I think the medical profession is a burgeoning field because everybody needs health care, and there's a lot of variety in the medical field. You can do inpatient, outpatient, and for nurses, there's public health in addition to inpatient, outpatient. Um, just great variety, great hours, depending on the job you have. Some hospital jobs, you have to work the night shift or the evening shift. You work holidays, so those aren't such great hours, but you can get jobs like I have in a clinic, and we're only open during the week and during the day hours, and not on weekends.
Okay. So when your patients come in, how do you create a sense of comfort, trust?
I think you just have to be yourself, and always primary in the interaction is respect. So you treat a patient with respect no matter what their background or their income level or their mental health issues, whatever the situation. You get a great response from people if you treat them with respect. I mean, just like you and I or anybody, your neighbors, your friends, anybody that you treat with respect, you're going to get a better outcome in your interactions.
Okay. What made you want to enter your particular field?
Why did I want to become a nurse?
Yeah.
Let's see. I think I like the idea of taking care of people and maybe getting people involved in their own care, because if people, you have to kind of talk people into buying into caring for themselves, to motivating people to taking care of themselves, because you can't do everything for the patient. But so it's interaction of motivation, I think.
Okay. How difficult was it to obtain that status?
My status as a nurse?
Yeah.
Well, let's see, I went to school for 4 years. I went to an associate degree program first in a community college in a little town in Indiana. And for 2 years I studied nursing and got an associate degree of nursing. And then I went 2 more years and 3 summers and got a bachelor's of science in nursing. And then throughout your career, you really need to take a lot of courses in various aspects of nursing. So wound care, IV therapy, just, frostbite, just all kinds of courses to update yourself, to stay current, because in the medical field there are a lot of changes that come around all the time, and so you've got to stay current. Sorry, my voice is
It's okay.
so bad.
It's okay. What do you view as the pros and cons of vaccinations?
Vaccinations, well, that's very interesting. I know a lot of people worry about their kids getting vaccines and getting maybe autism or mental illness or brain damage and things like that. I think from what I've heard in research is that those are unfounded complications, that vaccines really don't cause those problems. And I think people should vaccinate their children because the dangers of communicable disease being transmitted from kids, like in schools and neighborhoods and everything. It's very dangerous, and kids can actually die from these diseases or have really bad complications like deafness or brain damage or things like that from not getting vaccinated and then getting the chickenpox or measles or mumps or polio, whatever. So I'm all for vaccinations.
Okay. How safe are the tests that you perform on patients?
The tests, well, let's see, that I personally perform on patients, or like X-rays or
Yeah, X-rays.
X-rays. I think X-rays should be limited. I don't think we should just X-ray for every little thing. I think any medical test, there should be a really good reason to do the medical test, that it shouldn't be done lightly and often and without reason. So I think there needs to be a valid reason to perform any kind of medical test.
Okay. What are your opinions on medical marijuana?
Medical marijuana, let's see, I'm all for it. I think that it probably should be regulated maybe like alcohol. And of course that's social marijuana, I guess we're talking about too. Medical marijuana definitely, I think it's used for a lot of different reasons: seizures, headaches, and if somebody, I think probably it's pretty easy to get a medical dispensation or whatever you call it. I'm not sure what they... Prescription, yeah, for marijuana, but I'm all for it. It can be a medicine, and as with anything, it can be abused, and probably it should be regulated because there are so many different kinds of marijuana, different strengths, and it can be dangerous if it's not regulated, the dosages and the strengths of the marijuana. So yeah, definitely it's of value.
Okay. And is there anything stressful about your job?
Of course. I don't think there is a job without stress. And no matter what the field is in, whether you're a teacher or a secretary or a lawyer, or if you work at Kmart checking out people on the register, I think every job is stressful. So yes, there's definitely stress.
Okay, thank you. That's it.
Okay.